Hi there, welcome to Health with Samantha DPT. I'm Samantha Holland, Doctor of Physical Therapy, and this video is going to be talking about a brief overview of the lumbar spine and low back pain. Today, this topic on this video is posture and mechanical low back pain. Future videos will have other causes of low back pain as well. So we know that low back pain is a pretty prevalent issue in today's society, and I want to just go over some causes of that and some ways to help yourself. So I've got a list here of some of the 5 main causes that I see for low back pain. This video is going to be on poor posture or more mechanical reasons. We've also got spondylosis and spondylolisthesis, which I'll get into. I know those are fancy words, but mostly degeneration and instability or laxity in your spine. A future video will go over that. We've got a disc bulge and herniations. We've all heard of that. Stenosis, which is narrowing of the spine. And then we'll talk about the misnomer to some degree of sciatica, what that means, and then piriformis syndrome, okay? But today's video is on poor posture or mechanical causes for low back pain. All right, so here's a picture of the spine, okay? This is the full vertebral column here. The low back or the lumbar spine consists of L1, 2, 3, 4, and 5, which is at the lower end, and here's a picture of just the lumbar spine that we're talking about, okay? So what is mechanical low back pain? That means that something within the tissue of your spine, whether it be alignment, overuse, poor use of the area, is causing discomfort. And what I mean by poor posture is your lumbar spine has that natural lordotic curve, you know, that arch in your low back. Happens if you sit with your pelvis forward, you kind of exaggerate that curve. Well, sometimes that curve can become over exaggerated, and so think of your low back being like this, and if you add pressure on it, whether you're sitting, weightlifting, or just adding weight to your body, that's adding a lot of compression to that curve, maybe some undue compression that couldn't be there. We do have a natural system to help combat that pressure, and that would be your muscular system, especially your core, your deep core, your transverse abdominis, which there's a video on my page about how to do a proper transverse abdominis activation. It's mainly for this reason, to help protect that compression and add stability to your lumbar spine. So if you don't have proper core engagement and you've got this curve, and then if you think of the front of your body on this side of your curve, it's getting lengthened, that core is just stretched out because it's never getting contracted and worked, then you're just adding compression. But what we want to do is tighten this area, alleviate some of that curve, and take a little pressure off of your low back, if that makes sense. So that exaggeration of the curve can happen from, you know, just poor posture in general. That's just how you stand. You're never aware of that area, or sport related. If you, like I was a diver and we did a lot of extension in our spine and became hyper flexible, and I, you know, just kind of as a result of that became too flexible and really need to work on my core to counteract that. So something I want you to be aware of is if you're sitting at your desk or standing and you feel like you're starting to get some pain in your low back, try to rock your pelvis back or flatten out that back area of your spine. For example, if I'm sitting like this, if I roll back this way, it instantly takes some pressure off my low back. Now, that being said, some people can sit too far back, and that's causing a lot of stretch on the back of their spine. They may need a lumbar roll. A lumbar roll pillow is often used more for people who have some disc issues, and that will be on a future video. This video is more talking about a lot of compression in your low back from poor posture or mechanical issues. So, if you've had long-term exaggeration of the spine, chronic low back pain, potentially from that exaggerated curve, you could start causing laxity of the ligaments around your spine. A telltale sign of ligament laxity is if you have pain with prolonged positioning. So that means sitting for a long period of time, standing for a long period of time, any of those things, after a while you start to get achy and pain, need to change positions, that could be a laxity sign. Again, that means might need some stretching of certain areas and mostly core and hip stability exercises. All right, again, if you've got that curve in your pelvis tends to be forward, that could be a sign of shortened hamstrings, which also tends to be in the puzzle of mechanical imbalance when it comes to low back pain, mechanical cause, or poor posture. So the biggest takeaways from this video about poor posture would be checking in with your pelvic alignment. If you are having pain with prolonged positioning, you pretty much have to move periodically just to avoid excessive compression. Core activation and hamstring stretching are all very important. All right, if you have any questions or feel like you have more symptoms or different symptoms, stay tuned for more videos. Check out more videos on my page and subscribe. I'd be happy to help you. But thank you for staying tuned, and I'll see you later. Thank you.